everyone, it's Kristan Hawkins. Welcome to this new episode of the Explicitly Pro-Life podcast. Joining me today is a good friend, Doug Badger. He is the Senior Fellow at Domestic Policy Studies at the Heritage Foundation. As you all know, the Heritage Foundation were platinum sponsors, best buddies, co-hosts, I don't know what the name was, for the National Pro-Life Summit. We were so honored to have their new president, Dr. Kevin Roberts, keynote the National Pro-Life Summit just a couple of weeks ago. But I've asked Doug to come on. He has a wealth of experience in Washington, D.C. He got started in 1979 in D.C. with the Christian Action Council, which later became CareNet. So very early on in the pro-life battle, fighting the battles there on Capitol Hill against taxpayer-funded abortion. You've gone on to serve for in the U.S. Senate, the Assistant Majority Leader, Senator Don Nichols. Is that correct?
That's correct.
Okay, and then you were in the Bush administration. I was in the Bush administration. I was like low level. You were high level in the Bush administration, serving at Department of Health and Human Services. You've served at Social Security Administration, the White House. I mean, like, his bio is just, you should just Google his bio. It's unbelievable. But you were special assistant for President Bush, to the president on the National Economic Council. That is, I think, is a really important part of your bio. This guy knows what he's talking about when it comes to economics and healthcare. So I've asked Doug to come on today to talk specifically about why abortion isn't healthcare, the current proposals that are anti-life coming out of Washington, D.C., beyond just abortion as well. Because as you all know, and Doug certainly knows, the Medicare for All kind of language is still out there. The bills are still being, introduced and proposed in Washington. And this is something I think we don't talk enough about in the pro-life movement. It's certainly something when the Obamacare fight came in 2009 to 2010, the pro-life movement was wasn't really paying that much attention. And then we had to kind of ring the alarm bells and say, hey, this matters. Obamacare, this is something that's going to be the largest expansion of abortion. And sure enough, it was. And so we have to be paying attention to Medicare for all. So I guess, Doug, let me start off with, I don't know if it's a hard or easy question. Why is someone who is a pro-life activist, why should they care about Medicare for all and these government kind of socialist takeovers of healthcare? Because, I kind of hear the pushback sometimes from some of our more liberal leaning Students for Life leaders of, we love people, we want them to be born, and we also want them to continue living. So they should have access to high quality free healthcare. That's their human right. What's the concern there?
Well, I'll start with what's not the concern.
Okay.
I think people, whether they describe themselves as progressives, liberals, conservatives, really do want to have a system that works better for people. That is, that covers healthcare expenses, doesn't bankrupt them, and gives them and preserves the quality of care that Americans do get, unfortunately, at great expense. Now, whenever you say something's going to be free, I can tell you, as economists always say, there is no free lunch. Doctors aren't going to work for free. Hospitals are going to collect a lot of revenue, drug companies, and so on and so forth. So the question is, who is paying? And when the question becomes who is paying, that's the entity that will decide what healthcare you have access to. So let's think, for example, about countries that do have systems where the government determines who gets healthcare and how much. One characteristic of these systems is that you wait in line for care. It's free, but you pay by waiting months and months for a surgery, procedure, or treatment. The second thing that happens is, while your prescription medicines will be cheaper, what you will find is you don't have access to certain cutting-edge cancer treatments that manage heart disease and other kinds of ailments. The trade-off when the government allocates medical goods and services is that they're allocated according to political considerations and according to the sensibilities of a centralized bureaucracy, rather than a system that's built around choices that individuals make with their physicians about medical care.
Mm. That sounds scary for people who have complex medical diagnoses, or maybe are part of a rare group of people like my children who have cystic fibrosis. It's a small number of people who have it. And when you have, there was a big talk about death panels, and the leftists were saying there's no such thing as death panels. They don't exist. But there are panels of bureaucrats who do get to decide certain things in these countries of, we will have this many hip operations. We will, give out so many surgeries. And then if you don't make those cuts, you've got to wait till the next year.
That's right. And, take the example of the UK. They have something where they have a formula that they use, quality added life years. Mm-hmm. Now, if you're a 23-year-old athlete, you don't have to pretty much worry. You'll probably get the treatment that you need because you have a lot of so-called quality life years ahead of you. But if you're older, if you have a disability, if you have a quality of life that perhaps others think is not up to par, as it were, then a treatment, a drug, some sort of regimen that will help you won't be provided through the government health system, and you won't have access to it. So, it sounds nice to say, well, I'm going to give you free health care. Somebody told me I was going to get a free car. I'd like that too. But you have to dig a little bit deeper and find out, okay, what exactly am I getting and what price am I paying for this supposedly free health care?
The qualities are really scary because last summer, I actually remember I was driving into Washington for President Trump's RNC speech, the one that had all the protesters at the White House. And there was an 8-hour meeting that took place within the cystic fibrosis community, where there was an unelected panel of doctors and researchers and some parents who had assessed this drug that my children are on, Trikafta. It's a cutting edge drug. It literally corrects a genetic disease. I mean, it's unbelievable what it does. Very expensive. It's about $300,000 a year on the market. And they used the quality score. And they said that even if the drug was curative, which it's not, but my children have, even though they're 12 and 6, they show no signs of lung disease because they've kept up on their medicines, their treatments, and now that they've had this genetic drug that's changing the way the cells act in their body, they show no lung disease, which is unheard of. They said even if this drug is curative, it's still with the quality. Their quality score wasn't worth the cost, and I was like, I almost drove off the road. I was so irate. I was texting people. I was like, did you hear what they just said? It was unbelievable, but they were trying to be very matter of fact about this. And I think sometimes in the pro-life movement, we hear we should just stick with talking with abortion. And I agree with that. This is explicitly pro-life, but these are things that kind of seep into our culture because of this mindset that we have with abortion, these disposable human beings. Once these babies are disposable, now we can start saying, well, your life is only worth this many dollars. And your life, this is all part of that. Do you feel like it's part of this mindset they have, this culture of death? It
really is in the sense that from the very beginning, the pro-life movement has been about the value of an individual human life. We look at life from that perspective, the perspective of you and your children, for example, for me and perhaps a loved one who has an illness. And so that's how we think about and analyze issues. When you move in a direction where you want centralized decision-making, where you want the government and expert panels to make these kinds of decisions, as to how society allocates its resources, you're no longer thinking about that individual, whether it's an unborn child or a child with a serious congenital disease, or an older person whose physical and perhaps mental limitations have become great. Now you start to say, well, wait a second. Why are we spending valuable societal resources to help someone like that, who's never really going to have the sort of life you and I have? And so that's the mentality that even more than the abortion issue, the pro-life movement says that's not how we're supposed to think about these things. For those of us who come at this from a Christian perspective, we believe that human life is valuable because God created us in His image, and it doesn't matter how we might look to other people. We look to God as His child. To those who are secular, they may approach it a little bit differently, but fundamentally, what we all have in common as a pro-life person is we look at the value of the individual, not the usefulness of the individual to the collective.
So I'm just, when you're talking, I'm like, yes, make a short clip out of that. That needs to go on to me right now. But I'm hearing the other side of my brain. I hear the response from those on the other side who say, well, yes, we value human beings. We want, and this is why we need a government agency who's, doing this fairly, because, while Kristan may be able to get, prime health care for her children with CF because she has access to resources and connections or whatever people think that I have. But there's another child who has CF who doesn't have those resources. And so it needs to be fair. And fairness is, the government can provide fairness.
Yeah, and that's, I think, the thing you really need to think about, because we need to understand fairness also from the perspective of the individual. I was in Washington for nearly 40 years, and I can tell you almost nothing government does is fair. And if we entrust those decisions to people with political power and economic power, I'm not sure that we're going to think the results of that are fair. But how do we attack that problem of making sure quality care is broadly available, regardless of income, regardless of your medical situation? And that's the kind of thing that conservatives have been working on for many years. We want affordable health care for everybody. We don't want the government deciding who gets care and who doesn't. And we want the healthcare that all Americans have access to still be leading healthcare, right? High quality healthcare, the top healthcare. I mean, when you're talking about earlier, the access, you might have more affordable prescriptions in a healthcare that is a socialized healthcare system, but you will not have access to certain drugs. And it's the same with cystic fibrosis. My son he was not only in the clinical trial, but he benefited from a drug that still adults in other countries with cystic fibrosis are still just now trying to get, because their government agency would not pay the prices that the pharmaceutical company said that they needed. And so then the government agency said, well, we're just not going to pay for these drugs. And these are drugs that are sustaining life and extending life. That's scary stuff. It is scary, and it's true across the board, whether you're talking about heart and lung diseases, whether you're talking about cancers, whether you're talking about mental illness. People who struggle with mental illness in other countries don't have access to medications that people in our country who are on Medicaid can get. So that is a very big consideration and a critical consideration. We want quality, we want fairness, and we want affordability. And I would say, and I know
we want it all, is what you're saying.
We want it all, and I know people will be skeptical about this. The last people that are able to deliver on those three things is the government.
Yeah, that's a great point. What is the conservative pro-life alternative to something like Bernie Sanders Medicare for all. Because, I mean, anytime you look at any of the Democrats' proposals for government health care, one, if you know anybody who has a complex medical illness, they'll be scared out of their mind. Two, you can bet your bottom dollar that it's going to include taxpayer funding of abortions. I mean, that's like just something they just can't wait to force Americans to pay for. It's unbelievable. And also, there's always free hormonal contraceptives that could cause abortions, maybe won't cause abortions. They don't care, but they label pregnancy a preventable disease. So I'm still very angry about that in Obamacare, by the way, that something that I can do that you can't do is labeled a disease. Like that was what makes me special.
But you can still be a birthing person.
Yes.
Yeah, there you go.
Yeah, I also can be a birthing. Jeez, you're really going to get me going. So what is the pro-life conservative? Because I think a lot of times, especially younger people, all they hear from Republicans or conservatives is no, that's a terrible idea. No. And it's like, do conservatives have another idea, another approach?
Well, there are a variety of them, but one that I've been involved in with Heritage Foundation, a whole group of at least 100 conservative groups around the country, is called the Healthcare Choices Proposal.
Okay.
And in that proposal, the first thing I want to emphasize is there's a tremendous amount of federal funding that is distributed that will both help people who are low income afford their care, but also understand that there are middle income people with great medical needs and their income doesn't help. They need extra support from the government in order to be able to afford that care. All of this money, though, would be distributed to the states to establish these programs, and we'd allow different states to take different approaches as long as they were achieving the goal of making it affordable, regardless of income and regardless of medical condition. They could take different approaches, but none of the funds, and this would be in the statute, none of the funds could be used for abortion. So the existing Obamacare money that's going out with really no abortion protection, it's there sort of superficially, but everybody knows it's a joke. It doesn't really prevent government funding of abortions. All of that would be changed because as this money goes out, this repurposing of Obamacare money, it would carry the stipulation that it could not be used to finance abortion.
Would it add on to what we have now with ACA and Obamacare, where is it just supplementary? So does it still require people to purchase health care?
It would not come with a mandate, although, a state, if they wanted to mandate coverage, they could. There are states now, New Jersey is one of them, Massachusetts is another, that mandates that their citizens have health care coverage. So it would not come with a federal mandate. The mandate from the federal government would be on the states to say, show us your plan, show us how you're going to do it. And there are a variety of things they can do. And for low-income people, and I think this is so important, it's often lost, what happens in the Medicaid program is that low-income people are enrolled in the low-bid HMO. So the state puts out a request for proposal, and all these managed care organizations, some of them now are multi-billion-dollar entities, their CEOs make $10 million a year and so forth. They get the bid, and then the low-income person is enrolled in this HMO, and they don't have access to doctors. They don't have access to the best medical care, but they have free insurance. It's the same old story. What we've said is, states, when you set this up for a low-income person, you have to give that person the ability to direct the resources to the plan of their choice. So that low-income people can be in the same kinds of health plans that middle and upper-income people are. They're not ghettoized into a low-bid HMO. It's sort of like school choice, if you think about it. It's like a voucher. And now all of a sudden, mom who has 2 kids and a very low income, she gets to decide where she's going to direct that resource. Maybe she can't afford to join the plan her employer sponsors. Now she can, because now she's got these public resources that she can do that and get her kids to see the same pediatricians as the CEO's kids see. So that's the kind of reform that we're pushing for, and we hope that Congress will eventually pay attention to this and do something about it. There's lots wrong with the healthcare system. Conservatives think our healthcare system has no flaws or no problems, and it's only progressives who see the problems and want to fix them. That's really not true. We have a lot of problems, and one of the biggest ones is we treat low-income people and people with disabilities very, very badly in the Medicaid
It's very
program.
undignified.
Yeah. None of us would, believe me, none of us would stand for being enrolled in the sorts of HMOs that we're putting low-income people into it. We would not accept that.
Wow. And the reason you're saying these low bid, that's because the government, because there's so many dollars, so many people that be on these plans, the government basically says, we're willing to pay X number of dollars.
Right.
And you have to meet these very low thresholds. And then the companies kind of compete for how cheap they can provide this coverage and how much profit they can make.
If you could do it for, your company can do it for $5,200 a person, and I can do it for $5,100, I get the contract. And it doesn't matter that maybe your plan costs a little more because it provides a little better services. It's just the same process that the government uses to at the Pentagon to buy fighter jets or whatever. It's you come in, you present your bid, and the low bidder gets the contract, and if you happen to be low income, that's your insurance policy.
Is Medicaid, so if you're poor, you live, you're here in America, that is your kind of last resort, right? To getting government funded healthcare? It
generally is. As with everything else in healthcare, it's way more complicated than that. But the illustration I used, a mom with two kids, a pregnant woman who is very low income, if she doesn't have access to other kinds of coverage, chances are she will apply for Medicaid. And again, it's free. So if the out-of-pocket price is what you're looking for, you can't beat free. But the value of the coverage she gets is not that good.
This proposal, you're saying this choices plan, has this been proposed in Congress at all?
It's been, we have published papers on how it works. We've had an analysis showing that it would reduce premiums by up to 25%. It would increase the number of people who have coverage. It would result in some savings, and it would give people a broader choice of providers than they currently have. It has not been introduced yet as legislation. The Republican Study Committee in the House of Representatives has also outlined a plan, and they borrow very heavily from our proposal. There's a lot of cross-fertilization. So there's some fairly strong support in Congress, but in the current environment, unfortunately, it's not possible to advance it. The other thing I will say, and I will confess that I am a Republican, Republicans run from healthcare. They whenever the subject comes up, they get defensive and so forth.
They start talking about like national defense.
Yeah,
well, let's talk about this.
Let's cut your taxes. How about that? And not that those things aren't important, but the reality is we are trying as the Heritage Foundation and other conservative groups to kind of sit down and educate members of Congress and say, look, this matters to people. And what's going on right now in our country really isn't acceptable. We really need to do better. And you need to offer, there are good ideas out there. You need to offer those alternatives. The choice shouldn't be between the status quo, which needs to be changed, and, well, let's just have the government take it over and make it free. We have 330 million Americans. Is that the choice that the two political parties are really going to offer people? That's really not acceptable. We need to do better.
Yeah, you're right. There's really no conversation within the Republican platform right now. I don't really ever hear the members of Congress talking about this. What is the name of your plan again?
It's called the Healthcare Choices Plan.
That's something to keep in mind when you're talking with members of Congress, when you're lobbying them on, whatever pro-life law is out there or pro-abortion law is out there you're trying to stop. I would encourage you to get them to start thinking about this. What are they offering? What are they talking about when it comes to healthcare? What choices are they giving people? Because, as you just outlined so sadly with our current healthcare plans, and the status is, if you're poor in the country, you're treated terribly when it comes to healthcare. And we kind of go, oh, check. We got Medicaid, check. It's good. But it's not.
Yeah, and I think in many, and I don't want to be too critical of proponents of Medicaid expansion, but in a lot of ways it sort of makes them feel better about themselves, because they say, oh, well, let's put more people on Medicaid. And he's like, well, okay, but why don't you put yourself on Medicaid and let me know how long that's going to last.
And we know it's funny because even when the Obamacare stuff was being handed out, Congress was like the first group of people to say that they were exempt from all of that. It was unbelievable. I'm like, well, you don't have a lot of faith in the we'll read it after we pass it type of legislation when you try to exempt your own self and your own staff.
Yeah, and they ended up getting shamed into going on those policies, and nobody ever wants to say it publicly, but members of Congress and their staff don't like these plans any better than the average person who's shelling out money to buy it. So they know they're not really doing the best for the American people, and well, I hope that changes.
Yeah, and this is why this is how the policy and the politics kind of come together, because you can have all these alternative plans and ideas for how, but we've got to have the leaders in place on Capitol Hill who are willing to kind of make some bold changes and bold moves. And right now, as you all know, that's not happening. The bold changes and bold moves that we're getting are, let's have free abortions for everybody. Why do you think? I guess I want to end on that a little bit, given your kind of starting out in the pro-life movement in Washington D.C. I guess I ask myself this all the time: is what is in it for the Democrats to be so doggedly pro-abortion? Really, the cultural tide has turned against them when it comes to, you can go any poll. Second, third trimester abortions, Americans reject those abortions. First trimester, depends on how you ask the question, depends on what you said previous in the polling. But Americans don't like abortion. So why are they insistent in all of these, Medicare for all, anytime you're talking about healthcare plans, they're insistent about making sure abortion's right in there. And that's what we're going to be pushing. Why? Wouldn't it behoove them just to leave it out, and just that way you wouldn't have the whole pro-life lobby against them as well?
Yeah, it's hard because as divided as our country is, you see really both parties appealing to the loudest voices, not always the wisest voices, but the loudest voices in their base. And obviously in the Democratic base, you have a lot of very pro-abortion people who are in positions of prominence, and so the politicians play to that in order to get their votes. But as with healthcare, I think when you actually talk to people, whether they're Democrat or Republican, nobody really likes abortion. We all understand there are circumstances, tragic circumstances that women face, and that too often there are few viable alternatives that she can see in a very very difficult situation. But nobody thinks that's a great outcome when it happens. And certainly the extreme positions of post-viability abortions, live birth abortions. I mean, for crying out loud. These are things that are not supported generally, and we hope that the Supreme Court will open the door for states to put in place a much more humanitarian, a much more thoughtful abortion policy than the blunt instrument of abortion on demand.
Yeah, and I think that's really when the decision of abortion is returned to the states, what you're talking about with these healthcare choices. I mean, this is a very important thing because we think about post-Roe legislation and policy proposals. We really need to be talking about how do we support women in Mississippi where abortion will be made illegal? And so if she's pregnant in college so she can continue her education, that she can find a high quality, low cost daycare for her children so she can go to class and get onto her job. So there's a lot of things that we've got to be talking and thinking about for post-Roe America. And I think healthcare needs to be the top of our list for all of these things.
Could not agree more.
Well, thanks, Doug, for coming on. I really appreciate having this discussion with you.
Thank you.
I hope you guys enjoyed this conversation with an expert on healthcare policy and economics from the Heritage Foundation, Doug Badger. Make sure you look him up and make sure you follow the Heritage Foundation and all the great work that they're doing. They have so many experts like Doug. Like going through the Heritage hallways must just be like star after star after star policy experts every single day. So we are honored to be able to partner with them with the National Summit and so many other activities. Thanks, guys.